Welcome back. We all know we might be dealing with a new normal because of this COVID-19 situation. But the question is, how does COVID-19 really infect the body? And what kind of immunity can we develop against it? So joining us now to answer those questions and much, much more, we've got Nadim Khan, an assistant professor at the UND Medical School and an expert in lung inflammation diseases. Nadim, welcome to the show. It's great to have you with us. Let's just start with kind of the basics of, for someone that has coronavirus, how does it impact their body and more specifically their lungs?
So I will answer your question in two parts. So if you compare coronavirus disease with, say, seasonal flu, so seasonal flu initiate in upper respiratory tract, and in most of the individuals, the disease is self-limiting. It ends up causing symptoms like mild fever, rhinorrhea or running nose, mild headache, and etc. What happens in the case of COVID-19, that the virus has very little affinity for upper respiratory tract. So the virus directly gets into lower respiratory tract and affect your lungs. And which is why, although both seasonal flu and COVID-19 might present similar or overlapping symptoms, COVID-19 patients have the symptoms which are more intense and persistent. As far your second part of your question, how it impacts our body, so to explain in simpler terms is that our immune system overreacts to the virus. And it develops a much larger immune response that is actually needed to fight out the virus. And in scientific terms, we call it actually a cytokine storm. And this excessive and overreactive immune response leads to causing significant lung damage and pneumonia of varying severity.
So how do you contract it? I've heard from different people that some doctors that, you've got to be, for example, in a closed room for 15 minutes or more, pretty small area if it's going to be just through the air, for example. But the main way is that, I touch something and then I end up touching my face. I mean, what are the main ways of contraction and how do I prevent that?
Well, the main ways of contractions are the respiratory droplets. Suppose so if you get in contact with a patient or a carrier, and if they are coughing, they're sneezing, they actually exhale respiratory droplets. And those droplets actually can hang in air for some time, although we do not know much about that how long they can persist in air, or they may not. They could be on surface. So if you touch the surface and you touch your face with your fingers, so you can then actually, inhale those droplets. So in a nutshell, the infection is actually, transmitted through those respiratory droplets, and a person can actually acquire those droplets in different ways.
So do I need to be like in a room with somebody pretty small and then inhale those droplets? I mean, I guess give me a better idea, because, we, for example, go out to a store. Now there's all these different people that we don't know if they're infected or not, but they're in stores. If I'm within 15 feet, I know we've got the 6-foot social distancing. Give us some ideas there, please.
Yes, so as long as if you are 8 feet apart, 6 to 8 feet apart, and you're distant, that should be okay. But then the chances of the infection are very high when you are in close contact, you are spending more time with infected people or carrier, and you are continuously inhaling the air that is, circulating. So more closer you are in a room or in a place with infected or a carrier, more chances of infection. But as long as you're maintaining 6 to 8 feet of distance, and you have just a brief kind of, exposure to patient, then it should be okay.
The other thing that I haven't heard a lot of conversation about is things that people can be doing to build up their immunity system. So if I'm doing things to do that, keeping my blood alkaline, for example, things of that nature, will that help it to protect me from contracting COVID-19 or no?
Well, so anything that kind of boosts your immune system definitely improves the chances of fighting out the disease. So, for instance, anything, say, vitamin C. Vitamin C is generally a kind of enhancer of immune system. So, yes, of course, the food or supplements that can enhance your immune system, they can definitely help in fighting out the disease. But again, these are not tested, and we do not know for sure with the full clarity that how they can actually prevent the infection.
Let's get your thoughts on this. I just had a young woman actually from UND on my other show, and she had it and then went and got tested positive for the IgG antibodies. Any thoughts on using that plasma or treatment for COVID-19?
Well, there are some trials, clinical trials, in which they are using convalescent plasma. So people who have recovered from COVID-19 disease, they're using the plasma to treat the COVID-19 patient. We do not know a real success of that treatment yet. The clinical trials are still underway. So we should be having more data coming in shortly. And maybe in a month or two, we should have more clarity about how effective that plasma treatment is in treating COVID-19 patients.
Wow, thank you for that. Nadim, I could talk to you for hours. I've got about a minute left. Anything else that you'd like to share with our audience that you think they should know?
Well, I think the other thing I wanted to say that people who are at risk, actually, so the information from CDC is critical, Center for Disease Control. And if you look at the information from CDC, it clearly suggests that people who are older adults and people of any age who have serious underlying medical conditions, they are particularly at higher risk for developing severe form of COVID-19. And based on what we know, actually, people at high risk are people who are 65 years or older, people who live in nursing homes or long-term care facilities, and people with chronic lung disease and other comorbidities. So keep checking, the information from Center for Disease Control for more information.
And just for clarity, Nadim, would they be more at risk because as you get older, your immune system's not as strong, or what do you see as the reason behind that?
So your immune system may not be as strong. Also, your immune system may not be fully regulated. So you may actually initiate an immune response, but you may not be able to tell your immune system at what point to stop or to put a pause button. So you generate an immune response to virus, and then you keep amplifying that response, and that leads to causing significant lung damage and pneumonia of significant severity as a consequence.
Wow, fascinating conversation. Thank you so much. We'd love to have you back, okay?
You're welcome. Thanks, Chris.
Really, really appreciate that. Great stuff. All right, stick around. We got much more coming up right here on North Dakota Today.